We've all had that feeling. You've been on your feet all day or maybe stuck in a car for hours, and your lower legs they feel like lead weights.
Mm-hmm. Puffy, tight.
Right. And you just chalk it up to a long day. But what if that feeling, that simple heaviness, is actually a sign of a chronic failure in your body's plumbing system?
That is the exact question we're looking at today. We're doing a deep dive into stasis dermatitis, sometimes called venous eczema.
And this isn't just, some minor skin irritation.
Well, it's a huge warning sign. It's telling you that the hydraulic system in your legs, the one designed to push blood all the way back up to your heart, is starting to fail.
So our mission for this deep dive is to go through the sources you've gathered, the clinical guides, the medical papers, and pull out the really critical stuff.
Yeah, we want to unpack the surprising symptoms, the core causes, and the management strategies.
Which are very circulation focused. It's a completely different approach.
It has to be. And to start, we have to define it by its root cause: chronic venous insufficiency.
Okay, so break that down.
Imagine the veins in your legs are a one-way street, right? They're supposed to carry blood uphill, fighting gravity, back to the heart.
And they have those little gates inside them.
Exactly. Tiny, delicate valves that are supposed to snap shut to stop blood from flowing backward.
But when those gates start to get rusty or break,
that's when the trouble starts. Blood begins to pool or stagnate in the lower legs. And this pooling, it just skyrockets the pressure inside those veins. We call it venous hypertension.
So that high pressure then forces fluid out of the vessels and where? Into the skin.
Into the surrounding tissue, yeah. And that leads to this massive inflammation, all the irritation, and eventually the skin changes we call stasis dermatitis. It is fundamentally a mechanical problem.
Okay, that makes sense. It's a structural breakdown that just happens to show up as a skin issue.
Precisely.
So let's talk about the names for a second, because the sources use a few. Stasis dermatitis, of course, but also venous stasis dermatitis and gravitational eczema.
And those names are so descriptive. They're functional.
Gravitational eczema tells you right away that gravity is your enemy here.
It's accelerating the whole problem. And yeah, it shares all the features you think of with eczema: the redness, the scaling, the really intense itching.
But the cause is totally different.
Totally different. It's not an allergy. It's not primarily an autoimmune issue like atopic dermatitis. It's a skin problem caused by high internal water pressure.
Like a pressure cooker building up inside your lower legs.
That's a great analogy.
So if this is a hydraulic failure, who's most likely to experience it?
Well, the at-risk groups are pretty clear. It's anyone facing sustained pressure on their leg veins. So older adults are the largest group, just because those vein walls and valves weaken over decades.
Natural wear and tear.
Yep. And then you have patients with known vein problems, varicose veins, or maybe they've had a DVT, a deep vein thrombosis in the past that damaged the vein.
And it seems like the biggest accelerator is just not moving.
Absolutely. Your calf muscles are basically a second heart. Every time you walk, they squeeze the veins and pump that blood upward.
So people who sit all day, office workers, drivers,
or stand still for long periods, they lose that pump function. The sources also show it's more frequent in women than men after age 50, often linked to the stress of pregnancies.
Okay, which brings us to the most important part, the early warnings. If you're in one of those risk groups, what are the first signals you should be looking for?
The very first sign is almost always edema, swelling.
Just general puffiness.
Yeah, it's the visual proof of that trapped fluid leaking out. It might start just around the ankles, and maybe it gets better overnight when your legs are up.
But the really unique symptom, the one that tells you this isn't just regular eczema, is the color change.
Yeah.
Those specific orange or rust-colored marks.
This is the absolute aha symptom. You can't ignore it, and it tells you exactly what's happening under the skin.
Okay, explain that.
With all that pressure, red blood cells actually get squeezed out of the tiny blood vessels. Once they're out in the tissue, they break down. And the iron inside them, the part that carries oxygen,
it just leaks out.
It leaks out and stains the surrounding tissue.
So you're saying those rust-colored spots are literally iron stains in your skin?
They are. The medical term for it is hemosiderin. It's basically iron oxide, rust. It's a permanent tattoo telling you that your circulation has been failing for a long time.
Wow. And then on top of that, you get the redness, the warmth.
And the itching. A relentless, fierce itch.
And that's where the danger really starts, right? Because you scratch and that skin is already so fragile and stretched out.
Precisely. You create these tiny breaks in the skin, and suddenly you've opened a doorway for a serious infection. And if that pressure isn't controlled, the condition just gets worse and worse.
Let's talk about that severe stage for a minute. The sources use this term lipodermatosclerosis. It sounds pretty intense. What does that actually feel like?
It's awful. That's the stage where the chronic inflammation causes permanent scarring of the skin and the fat layer underneath.
So it's not just red anymore.
No, the skin becomes thick, dense, and hard. Patients describe it as feeling like wood or like leather.
So that would really restrict your movement.
It does. If it happens around the ankle, it can make it incredibly painful and difficult to even bend your foot. It's a literal loss of elasticity in your own body. And from there, the ultimate complication is the venous ulcer.
An open sore.
An open sore that is incredibly difficult to heal because the area has no good blood flow and is constantly waterlogged.
And that's a huge risk for infection.
Massive. Things like cellulitis. It's a serious progression.
Okay, so that's the what. Let's dig back into the why. We know it's weak vein valves, but what are the bigger systemic things that push this process along?
Well, beyond things like varicose veins, the biggest factor is system-wide pressure. And the number one cause for that is a weak heart.
The heart failure connection. This feels really important because you could easily miss it if you're just treating what looks like a rash.
It is a critical link. I mean, think of your circulatory system as a big loop. If the main pump, the heart, is weak, it can't pull blood back from the veins efficiently. It creates a backlog, a traffic jam.
And that traffic jam backs all the way up to the lower legs.
Exactly. So managing the heart failure is step one to controlling the stasis dermatitis. You can't fix the leak in the basement if the main water pump is broken.
That makes perfect sense. So what if the heart isn't the issue? What else increases that pressure?
Anything that increases pressure in your abdomen. Obesity is a major one. The extra weight physically presses on the big veins, making it harder for blood to return from the legs.
And pregnancy would work the same way.
Same mechanism. It temporarily increases that pressure and can be the trigger for someone who is already predisposed.
So what about that predisposition? Is this hereditary? Can you tell someone if your mom had it, you're going to get it?
Well, that's where it gets a little nuanced. The condition itself isn't directly inherited. What you inherit is the predisposition.
The blueprint for weaker plumbing.
Exactly. You might inherit genes for weaker vein walls or less effective valves. Then your lifestyle, a sedentary job, for instance, acts as the trigger that brings the condition out. It's that classic genetics plus environment interaction.
Got it. So since the underlying problem is chronic, we really can't talk about a cure.
No, not a cure. We can only talk about management. The goal is controlling symptoms and, most importantly, preventing those awful complications we talked about.
And the entire treatment plan is focused on fighting gravity and lowering that internal pressure.
It has to be.
So what are the pillars of that plan? What do you do?
Pillar number one is the simplest, leg elevation. You have to use gravity to your advantage.
So putting your feet up.
But specifically, elevating your legs above the level of your heart several times a day. This is non-negotiable. It allows all that pooled fluid to finally drain back.
Okay. And pillar two is probably the hardest one for people. Compression therapy.
This is the gold standard, but you're right, it's a huge challenge. Compression stockings or wraps act like an external support system for those weak veins.
They manually squeeze the leg.
Right, preventing fluid from leaking out in the first place and reducing the swelling.
But I can just imagine trying to get someone to wear tight, hot compression stockings every single day.
It's a massive hurdle. The sources all agree that sticking with compression therapy is the single biggest factor for success. But the fit has to be right. If it's too loose, it does nothing, too tight, and it can cause more problems.
So you need professional guidance for that.
Absolutely. A vascular specialist or a nurse who specializes in this.
So you're fixing the mechanics, but what about the skin itself? The dryness, that awful itching.
For the skin, it's all about maintenance. Using thick, heavy moisturizers, and they have to be fragrance-free all the time. You have to keep that skin barrier intact to prevent cracks.
And what about for a bad flare-up?
You might use a topical corticosteroid, but you have to be so careful. Short-term only. That skin is already fragile and thin from the pressure, and long-term steroid use can make it even thinner, leading to tears or ulcers.
Now, one thing in the sources I found fascinating was the role of nutrition. Specific vitamins.
Yes. This is where you connect the body's internal chemistry to the hydraulic problem. The vitamins aren't curing the broken valves, but they're helping the system cope with the stress.
Like which ones?
Vitamin C is a big one. It's essential for building collagen, which strengthens blood vessel walls and helps with tissue repair. Hugely important for tissue that's constantly inflamed.
And then there were the B vitamins, folate and B12.
Right. They're involved in regulating something called homocysteine. High homocysteine is linked to vascular disease and damage to the lining of the blood vessels. So keeping those levels in check reduces another internal stressor.
And the sources also mention vitamin D and niacinamide.
Yeah, vitamin B3. They both help with the immune response and help the skin barrier rebuild itself. It just shows you need a whole body approach for a mechanical problem.
So let's end by really hammering home the stakes. What happens if a patient just ignores the early signs? The swelling, the discoloration.
The risks are severe and potentially life-threatening. The first is cellulitis,
A bacterial infection.
a rapidly spreading one. It starts in a tiny crack in the skin and causes this intense, advancing redness, warmth, and pain. It often means a trip to the hospital for IV antibiotics.
And the other risk is that permanent damage.
Yes, that lipodermatosclerosis we talked about. Years of neglect can lead to that irreversible hardening of the tissue. It means chronic pain, limited mobility. It can be a truly disabling condition.
Every one of those signs, from the swelling to the iron spots, is a serious vascular warning. It's not just a rash.
Absolutely not.
So the big takeaway from this deep dive really is that stasis dermatitis is driven by hydraulics, by physics and gravity, not by a typical immune reaction. And the challenge is that you have to fight that pressure every single day.
You can't just put a cream on it and hope it goes away. You can't cream your way out of a plumbing crisis. You have to fix the flow.
So what does all this mean for you, the listener? Well, since SD is tied to chronic venous hypertension, this pressure problem caused by tiny, faulty one-way valves, it makes you think about the silent work our bodies do. We never really consider the incredible engineering it takes to pump blood uphill against gravity all day, every day. So when your legs feel heavy or your ankles swell or you see those strange rust-colored spots start to appear, these are not minor annoyances. They're warning signs of mechanical stress. The real insight here is that the symptom you see on the surface, the rash, is often just telling you that a fundamental low-grade mechanical failure is happening deep inside a system you normally take for granted. So pay attention to the pressure.